Welcome to the Full Circle Women's Care Mandatory Practice Orientation, Pregnancy Orientation. Welcome to how things go at full circle during pregnancy. And so glad to have you guys here. See some people who are still joining. So welcome. You all should be able to see my host's screen now. So please raise your hand if you're able to do that. I should see some hands going up because that will also mean that you can hear me. And don't see hands going up. Uh-oh. Can everyone hear me? Okay, there we go. All right, hands are going up. All right, maybe it's just me. Maybe I have a lag here. A couple housekeeping items. One, this is confidential. So you all weren't able to tell whose hands were going up, but I can, even with my possible internet lag over here. But please use the chat feature to ask me questions in real time because this is live. This is not recorded. Please participate. I have a couple of polls hidden throughout here to make sure that we are still engaged and still listening and paying attention and awake. And then if you miss any part of this, I understand we will be pushing into dinner time for some of you. This entire presentation will be available on our YouTube channel, Full Circle Jacks, afterward. So just by registering, you will get a link. You'll get a message from Zoom in a couple of days with a link to rewatch this. So let's start out with an example of what the poll questions are like. I'd like to know who is on the line. How many first-time mamas do I have here, and how many veteran moms do I have? So this is what the polls will kind of look like. I'll talk a little bit, give it a couple of seconds for you to answer, and then I'll say polls are closing in 3, 2, 1, boom. And today, oh, it's even. We have the same number of first-time mamas as mommy veterans, and I think we have a couple of dads on the line too. This is a nice big crowd. It's still growing. Awesome. All right, and then we will move on to the next things like today's topics. So today we're going to go through the full circle experience, which includes where we deliver, our office protocols, what to expect at each visit. We'll give you some prenatal resources, go over exercise and nutrition and pregnancy, and then close with a quick COVID-19 update. So to start out, just the basis of Full Circle's philosophy. We are a collaborative midwifery model when it comes to pregnancy. So many of you came in as GYN patients of either myself or Dr. Marrow or Dr. Mooney. And the thought was, all right, now Dr. Marrow, Dr. Mooney, and Dr. and Adams are going to deliver my baby. Well, maybe. But more likely, because we're a midwifery model practice, the midwives are handling the obstetric portion of the practice under physician guidance. The midwifery model is based on the thought that pregnancy and birth are normal life processes. In the traditional midwifery model, they take care of normal, low-risk women. But if you identify some abnormality that means that you're unable to deliver, for example, outside of the hospital, you have to transfer out to a practice that has physicians for different acuity of care. In the collaborative model, though, you can stay under the care of the midwife because they'll be the ones who are attending your labor and your delivery, but with physician directions for any complications that may occur. So to that end, the majority of the vaginal deliveries are performed by our certified nurse midwives. Certified nurse midwives, all of them actually begin as labor and delivery nurses, went back and got advanced practitioner degrees, so they're all ARNPs, and then got an additional master's in midwifery for care of the normal laboring woman and newborn care. Now, some things do fall outside of the scope of nurse midwives, and so physician consults are available at all times for them at every stage of anyone who's laboring. If it is something urgent, meaning that it needs to be addressed, but it can wait about 15 minutes. All of us live about that distance from our hospital of delivery. And so the midwives know to escalate to one of us so we can come in and take care of you. This is things like, oh, labor stopped progressing and we may need either some operative delivery, some rotation, or a C-section. If it is a true emergency, meaning it cannot wait 15 minutes, and those are not very common. There are OB hospitalists who are board certified OB-GYNs in-house 24 hours a day. To put that into perspective, as in not that often, we did 540 deliveries in 2022 and only two of them did they have to consult the hospitalist as the physicians from Full Circle were coming into the hospital. And even then, we were there for the delivery because sometimes it takes just that long to get to wherever you need to be. So, where do we deliver? Our hospital of delivery is HCA Florida Memorial Hospital, which is located not very far, about 9 minutes or less from our Full Circle offices. They are available to do tours, and in fact, they have an event coming up in February. So if you follow us on our socials, you'll be seeing the announcements for the baby shower or stork tours that they have. The last one was super cute. They had prizes that they raffled off. You got to meet some of the labor and delivery nurses, walk around, take a look at the facilities. But they do have one-to-one tours available. So during your prenatal visits, you're more than welcome to ask the midwives. They have a phone number that you call and they will directly set up a tour for you. They do them in the afternoons, they do them in the evenings, really, or you can just show up during the day and someone will stop and give you a tour of the facilities so you can see where you're going to welcome your little one or little ones. They also have classes at HCA. So childbirth education classes, there are 5-week classes or condensed classes on the weekends. And these help you to prepare for labor, delivery, and taking care of a newborn, as much as anything can prepare you for that. They also have breastfeeding classes. They have amazing certified lactation consultants who are on staff there. And they are in the process of training at least one more of the postpartum nurses who is also a doula to do more of their childbirth education. But breastfeeding classes, how to tell if your baby's getting enough, pumping, going back to work. And the cutest thing, big sibling classes. So for veteran mommies who are welcoming another baby into the house and you're wondering how older brother or sis is going to take it, these classes are very adorable and teaching them how to be big helpers and welcoming to your newest addition. And the same phone number that you call to arrange the tours you call for those classes as well. The hours of operation for our practice are Monday through Thursday from 9 a.m. to 1 p.m. Then we close for lunch from 1 to 2. So if you call us during 1 to 2, you will get the after hours message, and that's for a reason. It's because our after hours message is connected to the emergency on-call provider. So if you have an emergency between 1 and 2, please leave a message because the on-call provider will get it. We do open back up at 2 p.m. and we're open then until 5 p.m. So if it's not an emergency, please don't leave a message for the emergency on-call provider because she is at the hospital and she can't change your appointment in the afternoon or do whatever administrative task, find your paperwork and that sort of thing. Please just give us a call back after 2. On Fridays, we're open from 9 a.m. to 1 p.m. So if you're calling with an administrative matter right before the office closes on Friday, 12:54 p.m., just know that that may be answered on Monday when we reopen at 9 a.m. 9 a.m. on Monday, unless it's a holiday, which we don't have very many of those. All right. Also, when you're calling, I believe there's a question here while I'm waiting for the next slide. When did you guys switch hospitals? This is specific. But do they keep you in the same delivery room as postpartum? I should probably plan a tour. That's a great question. So actually, we switched hospitals back in October. If you go to our website, fullcirclejacks.com, there is a banner across the top that says, if you missed the town hall on us switching hospitals, please click here. So you can click there and watch the town hall that I held to just kind of go over what our reasons were for switching. The next slide is not really coming up for me. There we go. Okay, appointments. We don't have any walk-in appointments here because our goal is to see you as close as possible to your scheduled appointment time. We can't do that if we promised you a 3 p.m. appointment and somebody else walks in at 3 p.m. saying they need to be seen right then. We do have a limited number of same-day appointments. Sometimes our schedules, for whatever reason, don't fill, or they do fill and people deliver and then they don't need their appointments. So the schedule's clear. So there are times that you'll call in the morning and say, hey, I'd really like to be seen for this. And we'll say, you're in luck. Jane has a 10:40 or Lauren has a 12:40 or what have you, and fit you in for that. If you believe you cannot wait until whatever that appointment time is, then we may recommend that you're seen at an urgent care or at the hospital where we have one of our providers there. It's not us saying that we don't want to see you or take care of you. It's us agreeing with you that what you have is urgent and it should not be sitting in our lobby or at home waiting until we have a designated spot, but also trying to be respectful of your time and the time of those who have already scheduled appointments and will already be in those slots. If you are calling in with questions, providers are unable to leave patient appointments to take phone calls. Again, that is respecting the time of the person who has scheduled that appointment time. So if we're already seeing you at 10:40, we're not going to leave the room to go answer somebody else's questions. That is your time to ask us questions. And by the same token, when you're calling in, just know that we are here seeing other patients during that time. We do have a nurse who is trained in triaging OB phone calls. Many of the questions that we get are pretty common and routine, and Tony is able to answer a lot of them on her own without contacting us. If there's something that's outside of her scope, though, she knows how to reach out to the provider on call to get an answer fast for you. You have to leave a message in order to get a call back. I know some people will call and hang up and call and hang up and call and hang up and say, no one ever called me back. That's because no one ever knew you called. Because you'd be surprised how many people pocket dial their gynecologists. So we don't call numbers that just flash up on our caller ID. We call back people who leave a message. Now, leaving the message with the right person is very important as well. So if you have a triage issue, Tony, as I mentioned, is our nurse. She's also the person who does FMLA paperwork, disability forms, and that sort of thing. We have an OB clinical coordinator, Naisha. Many of you have already heard from her because she's the one who sends out your lab work. She sends referrals, like if you need to see the high-risk doctor or cardiologist or hematologist for IV iron, that sort of thing. If at the end of pregnancy you need something scheduled. If you're having an issue with your insurance, we're nearing the end of January, so I think we're getting out of this miserable season where everyone is changing their insurance and we're having to update it. But if you have any changes in your insurance or something happens in the family and you meet your deductible and you need us to take another look at your prepayment plan, definitely reach out to Renee Hall. She's the one that you met at your confirmation visit who had already checked your benefits and set expectations for patient financial. Or if there's anything you don't understand about your insurance, Renee's also happy to go back over there, over all of that with you again. All right. Um, Sorry, guys, this is really slow for me. After hours, there is always somebody from our practice who's on call for the practice. And so if this is like you need to go to the hospital. So this isn't, oh, I forgot what Lauren said to me during my visit. Let me just call back and have them read the note back to me. This is I'm having contractions, I'm bleeding heavily, I don't feel the baby, my blood pressure's high. If you think you need to go to the hospital, please call the main number and follow the prompts to get to the emergency on-call provider. Again, you have to leave a voicemail for it to even register that a phone call came through. So please follow all the prompts to the end, leave us a voicemail, and we will definitely give you a call back. When you listen to that, it does say if you don't get a call back in 20 minutes, please call back. If it's a real emergency, don't call back. Come on to the hospital because remember the person answering the phone is also the person who is on call laboring with somebody too. So if she's in pushing with somebody and what you have really can't wait 20 minutes, she's at the hospital. Go on in. Patient portal is another way to contact us, but please remember those response times can take up to 2 business days. When you hit send on that message, it immediately flashes up a message that says 48 hours. Think 2 business days. So if whatever you just sent us cannot wait 2 business days, then it should not be a portal message. The things that I just mentioned, like I need to come to the hospital, bleeding heavily, can't feel the baby, high blood pressure, 2 business days. Those things should not wait for that long. Other things about the portal, if you send non-action items like, I was wondering if I can take this supplement, what we'll likely do is pass that message on to the next person who's going to be seeing you at your prenatal visit, and then she can answer that at your next appointment because we do see patients all day long. And then we chart and then we review labs and we review ultrasounds and send them out to the portal. So portal messages are things that we are doing in our spare time that we're supposed to be with our families at the end of the day. So having whole appointments and visits on the portal is not really good use of the portal and of our time or yours. The portal is more for things like I lost my lab slip. So we can definitely pass that to our OB coordinator and she can email you a new one. 2 business days. Or if your appointment is more than a couple days away, you test positive for COVID or flu, you need to cancel your appointment, that's something that you can definitely send over the patient portal if you're, too sick to call front desk and speak with one of them. Things that we don't want to see on the portal, again, urgent matters, like my blood runs cold when I haven't felt the baby move in several days. Please don't send that over the portal. Actually, don't let several days go by before you tell us something like that. If you're having sky high blood pressure concerns, that sort of thing, those are phone calls. Though that is why we have an emergency on-call person answering phone calls 24 hours a day, 7 days a week. Don't send blitz messages. That is portal abuse, sending the same message to me and to Jane and to Cindy and to Dawn and to Lauren. Because each one of these people does have 2 business days to answer. So if you send a message, don't get a response in 2 hours, sending the same message to somebody else. Someone who was very upset once because she had 5 prescriptions waiting for her at the pharmacy for one complaint, but she sent the same message to 5 people. So multiple messages to one provider and or multiple messages to different providers. We'll get a lot of people working on what you're doing, but also not the most efficient use of our time because those people could be working on someone else's problem at the same time. And then please don't attempt to have a full appointment over the portal. If you have questions, things that can wait until your appointment, such as things about supplement use, text yourself questions. Start a thread with yourself or schedule an appointment. We're here making appointments, seeing people all the time. It can be a virtual visit, but we're happy to see you and have full conversations and answer all your questions in real time. So a lot of times one question brings up 3 more questions, and so then we're in a full conversation over the portal, and we prefer not to do that. All right, patient portal is also where we send out your ultrasound reports, unless there is something urgently abnormal discovered on your ultrasound. In that case, we will not let you leave the building until you've spoken with one of the providers on the same day and a plan is made. Otherwise, it does take 2 business days because the ultrasound reports are downloaded from the machine, uploaded into our electronic medical record systems, assigned to one of the providers to review, and then we go over it when we send it out to the portal. If you know that your anxiety will not allow you to wait 2 business days to find out what was on your ultrasound, please be sure you make a prenatal visit on the same day following your ultrasound. Otherwise, just know that whatever it is on the ultrasound that they found, it's something that is not urgent and could wait. So these are things like we need to repeat it because the baby was turned in a funny direction, so we couldn't see all the stomach views or the leg views or the heart views. Not anything we're worried about, but we just want to look again. So that may be something that you'll get on the portal in a couple of days. Typically, at the time of ultrasound, you'll get a little slip saying that you need to schedule another ultrasound in 2 or 4 weeks or 6 weeks, whatever the interval. And just know that whatever that is, if we're letting you walk out without stopping you, sitting you down in a room and going over the results with you, it's not anything urgent. So please give us a chance to receive the reports, review them, and release them to the patient portal. Quest also has a portal. The annoying thing about Quest's portal is that sometimes they send you the results, but they don't send it to us. Or they send it to you first, and then you get the results and you see all this red on the paper and it freaks you out. Oh no, it's abnormal. Just remember, red doesn't necessarily mean abnormal. The reference ranges, meaning the normal values that Quest has, are for people who are non-pregnant. When you're pregnant, the reference ranges, the normal values are different. So I had a whole back and forth with someone once about her values. And then I said, I don't even have your results back. Let me get a chance to receive them. And when I got them, it turned out what she had was normal for pregnancy. And so she was worried for several days for nothing. If you've had your results from Quest for over a week and you haven't heard from us, then let us know because, like I said, sometimes we don't receive them at all. And then we can reach out to them and get them. But please, as soon as you get your Quest results, please don't upload them to the portal because you will find that you'll get them back from us and then you'll get them back from somebody else and we'll end up reviewing them multiple times. And again, it's not an efficient use of our time. So give us a chance to get them from Quest and release them to you. The question that I have here is that a virtual follow-up was scheduled for me after my ultrasound. but the report was ready for the midwife, was ready or maybe wasn't ready yet for the midwife to review. Does that mean I have to schedule another appointment to hear the results? To hear them, yes, you would have to schedule another appointment, but you'll receive it over your patient portal within 2 business days of when the ultrasound was done. Now, if this was a very recent one and maybe the results went to Missy, she's been very, very sick. She was out of the office yesterday and oh, well, today, and will probably be out tomorrow as well. So we're working to disseminate the reports that were assigned to her during the time that she was on call. That's a good question, though. But yes, you will receive your ultrasound reports. The only pictures that you receive, though, are from your confirmation because that's the last time that reports are linked to pictures. Good question. All right, let's move on. What to expect at your prenatal visits. So, text yourself questions. Remember, pregnancy brain, placenta brain, they are real. And there's something about walking through the front doors of our office that make you completely forget every question you meant to ask at your prenatal visit. So if you start a thread with yourself, typically by the time, when you come in, we're checking blood pressure, we're talking about your labs, we're asking how you feel, is baby moving and that sort of thing. And then once you hear that baby's heartbeat, you're just so full of oxytocin, you can't think of anything else and you forget all your questions. And then you get in your car and you're like, "Oh, let me send a portal message." But if you text yourself questions, you can always refer to your text message thread with yourself and you can let us know what your questions were. Please wear loose, comfortable clothing so that we can access your belly. We will be listening to baby's heartbeat at every visit. If for some reason we have trouble hearing it with the Doppler, then we would take you to get an ultrasound in one of the ultrasound rooms just to hear the heartbeat. But we're not doing ultrasounds at each visit, but we will be taking a listen to and just feeling to see what position and direction baby is facing. We ask you to come in about 5 minutes ahead of your scheduled appointment time. That'll give you a chance to check in and handle any business with the front desk and leave a urine sample if you need to. We're not routinely checking urines anymore. So for my veteran mommies who had babies 5 or more years ago, American College is no longer saying that we need to check urine every single time. If we're looking at your urine for protein because of high blood pressures or blood sugars, or if you recently were treated for urinary tract infection and we're making sure that you're cured, then you know that we need a urine sample from you. Otherwise, you're pregnant. We know you have to go to the bathroom. Come on in, go to the restroom, stop by the front desk so that we can be ready to see you at your scheduled appointment time. If you're 10 minutes late, we'll still have some time to check on you and your baby. That obviously leaves a lot less time for your questions that are on your phone. If you're 20 minutes late, we missed the entire appointment slot. Front desk is really good at realizing, hey, she's running a little behind. She's not going to make it. There's a spot on another provider's schedule 20 minutes down. Let me see if I can just slide her over there. So by the time you walk in, they may already have you on another schedule if you've missed your entire appointment. Now, if that time doesn't work for you, then you don't have to keep it. It's okay. Maybe they can work you in even later in the day or can reschedule to another day that works better for everybody involved. But we do our best to honor the time that you are putting aside for the visit, as well as the people who were able to show up at the time that they were scheduled to be seen as well. Diagnostic ultrasound visits. So a question that I get is, when am I going to have another ultrasound? I need to be able to tell my family when to come with me. Great question. These are separate from your routine OB visits. So the way to know if you have an ultrasound coming up is to look on your portal. Do you have more than one appointment time? And is there a provider's name associated with your visit? So Tina Test is my pretend patient who I use as an example. When she logs into her portal, she clicks on the appointment tab, and that takes her to show all her upcoming visits. So this will show Tina that she has 2 appointments coming up, one at 9:20 with ultrasound. Ultrasound is not a provider's name, and one at 10 o'clock with Dr. Yeckel. Dr. Yeckel is a provider's name. So Tina has 2 different visits on the same day. The first one is with ultrasound, which is one of our ultrasound techs. So Tina is having an ultrasound that day. And so she can tell her family, come with me. We're going to do an ultrasound at 9:20. If you need to cut out, the visit is at 10 o'clock. You don't have to stay for that part. And that's fine. Or your family member is also welcome to stay for your visit. But if she's looking for how to help her family plan, then she'll know that she has the ultrasound first and the visit with the provider afterward, at which time she may be able to go over a partial of the results that are available for review. Remember that these visit results were sent to the portal within 2 business days. Again, if part of the partial report is available for the midwife, she'll be able to go over it with you in real time on that day. If there's something urgently abnormal, say it with me, we won't let you leave the building. We will discuss it with you on the same day. When you're checking out for an appointment and one of the providers says, hey, next time is your ultrasound visit, be sure you're scheduling 2 appointments on your way out. So we are usually sending messages to them saying, hey, you need to schedule this and you need to schedule that. But sometimes y'all are fast, man. Y'all get to the front desk before our message does. And so please help them help you. Let them know, hey, I'm supposed to schedule both an OB visit and an ultrasound when those things are due. All right. If you don't think we're doing enough ultrasounds, like if you want to see your baby even more, boutique ultrasounds. I was just talking to somebody about this today. So my kids are not going to be able to wait until it's time to find out whether it's a boy or girl. They want to know now. So boutique ultrasounds are a thing. These are a couple of places for informational purposes, not endorsing anyone over the other, but just giving you a couple options all over the city. And many of them will do gender reveal packages at 14, 15 weeks or so. And you can just take a look. These are fun ultrasounds. They're not diagnostic. They're just fun. And the family can come in and they put the heartbeat in a stuffed animal and give you all these 3D pictures. They're super cute. So just know that this is another thing that between ultrasounds with us, if you just want to go and check on your baby, this is another place that you can do it. So we have a poll question now. When should you expect routine ultrasounds? Would you expect to have them at every single visit? Would you have them at 20 weeks and if you go past your due date? Or do you only get ultrasounds if you have a problem? The polls are open. So you guys are voting now, and we are going to close the polls in 3, 2, 1, boom. All right, the answer is at 20 and 40 weeks. So this is routine ultrasounds. So routinely, we do the anatomy ultrasound around 20 weeks. We're not doing them at every visit. We're listening to baby's heartbeat with the Doppler at every visit, but not doing an ultrasound unless we can't find it with the Doppler. Sometimes the heart's really small. It's hard to find. And we do them even if you're not having a problem at 20 weeks. If we can't see everything we need to see at 20 weeks, then you would have more ultrasounds until we see everything we need to see, but that's not routine. Routinely, we see everything. All right, now we're flipping over to our website, Full Circle Jacks, and there's that banner I discussed. If you missed the Full Circle HCA Town Hall and need to see it again, please click there on the blue to watch the event and get all of your questions answered. So that was back in October, and it has been a fabulous move. It's been a really good move for our practice, and patients have been very happy with us getting over there. Many of you have had babies with us before at Ascension, and it was before some of the things that happened in the webinar. So there's your cliffhanger. You can see what happened. All right, we will start with the providers. So one of these lovely ladies will have the opportunity, the pleasure, the privilege of helping you welcome your little one or little ones into the world. So there's me. There's my partner, Dr. Marrow. My other partners, Dr. Yeckel and Dr. Mooney. Midwife Lauren, Midwife Krista, Midwife Cindy, Midwife Dawn, Midwife Missy, and Midwife Jane. The full-time midwives who are most likely to deliver are Missy, Carol, excuse me, the ones that you're most likely to see during your visits are Missy, Jane, and Dawn. Everyone try to get a visit with Lauren, please. She's part-time in the office, but I don't know, babies are attracted to Lauren. She ends up delivering as many or more babies than anybody else, even though she's part-time in the office. So our bios are on there as well. Get to know each of us individually as well at your leisure. Over here under patient information, you'll see the obstetrics tab. And when you click on that, you'll know you're in the right place because you'll see all the babies in the belly. And remember, all this is at fullcirclejacks.com. So our delivery stats are out there, and our 2023 numbers should be coming out really soon. We usually make a post right about now with what our numbers look like. So know that that is coming out very soon. Many of you are with us because of our delivery stats, trying to avoid unnecessary cesarean deliveries. So just know that our numbers are out there back to 2018 because we are very transparent with what happens here. Prenatal care timeline is the one that we're going to click on first, though, because this will give you an idea of what to expect at each visit. So everyone who is on the line has already had their pregnancy confirmation, and many of you have already had your history visit. So we like to do our confirmation somewhere between 8 and 10 weeks, and that's your ultrasound visit and your review with one of the midwives where we set the due date. Then you have your history with me where I go over any medical issues with you, and we order your routine prenatal labs. Some of you will opt in for genetic testing, which is optional. You have to be at least 10 weeks to get that done. And so we order that for you with or without ultrasound, with or without the baby sex. At this point in the pregnancy, we're seeing you every 4 weeks. So about 4 weeks after your initial confirmation, you should be back here in the office to do your physical exam. Your history with me is virtual, but then your physical exam is obviously in person because it's physical. Got to touch you. The physical exam is a routine physical. We listen to your heart, we listen to your lungs. A pelvic exam is part of it. It is with or without a pap test. If you're due for a pap, you're more than welcome to get that done at that time, but that's not necessarily part of the prenatal panel. You'll see the labs that are listed there in the middle because we're also transparent about what labs are standard. So the standard labs that are ordered after you see me are usually your blood type and blood counts and serologies with the urine culture. The other part of that panel includes cervical cultures. These are required by ACOG and Duval Health Department of Health. Then about 4 weeks later, you're coming back to the office for your second trimester check-in. And that's where we just do a belly check and talk about what things are normal in second trimester. You start to feel the baby move, have a little round ligament pain, that kind of stuff. There's some more additional optional testing for genetics in the second trimester too. Then, right around 20 weeks, you're back in the office for your OB anatomy ultrasound. And if you need to talk about it on the same day, a visit with one of the midwives. You'll see in the middle there mental health screen too. So we do screen for depression and anxiety throughout pregnancy because pregnancy can be a lot. And we want to make sure that we're paying attention to the whole person and addressing any of those issues as they come up so that they don't snowball into something greater, that we could have helped you enjoy your pregnancy a little bit more if we did. You'll also see in that third column a flu vaccine. If you haven't already gotten it, we're still in flu season and the flu is rough this year. It is very rough. And so that is something that continues on through March. Um, then childbirth education classes and or breastfeeding classes, you can start looking at figuring out when you want to pick those or complete those because again, those are about 5-week sessions if you do the full length sessions. About 4 weeks later is when you'll be back to look at the glucose testing. I do have a section on glucose testing coming up, so if you have questions about glucose, hang on to them for just a second. My moms who are Rh negative, this is when we want to make sure that you have Rogam, which is a certain medication that we use to protect future pregnancies. We administer it around 28 to 30 weeks. This is when we'll give you access to fill out your registration at the hospital. You'll want to schedule your hospital tour around this time. And if you plan on working with a doula, we'll talk about doulas in a moment as well. You want to secure who you're going to be with. As we go to the second page, I'm going to answer this question. Do we absolutely have to get the flu shot? No, you don't absolutely have to get the flu shot. I only said that because it was in all caps. But no, you don't have to. It is just recommended for those who usually get it. It's safe in pregnancy. So that's just letting you know that. After that, after those 28-ish weeks or so, we start seeing you every 2 weeks. You'll see there in the middle the option to repeat or decline the standard prenatal labs. This is the STD screening panel. Again, Duval County Health Department covers a multitude of risk stratifications across the county. And if you feel you are in a lower risk population to contract any of those during pregnancy, we do have standard opt-out forms that you can sign at that visit. For your third trimester vaccinations, we have Tdap listed on here, but RSV is now also included in third trimester in order to confer immunity to baby, passive immunity, so that by the time baby is born, you have antibodies that you can pass through your breast milk to baby as well. My first time mamas, this is when you want to start looking for your pediatrician because as much as I love those babies while they're in the belly, when they come out, they need their own doctor. I have three of my own little babies I need to take care of. I can't take care of y'all too. So look for your pediatrician. My veteran moms, you want to decide whether you're staying with the same pediatrician and just have that information ready for when you deliver. And these every 2 week appointments continue until you're about 36 weeks. Now, during this time, my moms who have some other complications with their pregnancy, like high blood pressures or high blood sugars, may start some additional antenatal testing here, listening to baby's heartbeat more additional ultrasounds. Then we'll do that and schedule that per person as needed. My moms who are anticipating having a belly birth, which is our word for cesarean. Usually we try to get your date solidified. We know that that's coming up right around the time you're 33-ish weeks. We'll get that scheduled for you around 39 weeks. At 36 weeks is when we do your pelvic exam for group beta strep. And if you've already opted out of repeating STD cultures and screens, then you've opted out of repeating the one at the end as well. And this is when we start seeing you every single week. So after this visit, you can bring in those birth plans. We'll talk about those in a minute. Start your natural cervical ripening methods. That's also coming up. My belly birth mamas will get off the train right around 39 weeks. And those who are waiting for baby to give the signal for labor, it's time to be patient because everybody around you is going to ask you every day, did you have the baby yet? Did you have the baby yet? Like you're going to actually forget to tell people that you had the baby. So just be patient and be patient with them because everyone will be evicted by 42 weeks. So for my first time mamas, usually 41 weeks and 5 days is when we want to say we want to come in for induction because our inductions are not quick. We do very gentle, very slow inductions, and we give baby time to try to come out and get the process started physiologically. For my second time mamas, 41 weeks and 6 days because usually your labor is about half the length of your first time mamas. All right, so just know that is what to expect at each visit. You have access to this document on our website. And for first-time moms, just know the average length of labor for you is about 24 hours. And second-time mamas, just know your average is about half the time your first labor was. Okay, next, pregnancy-safe medications. I have a poll question. If you have a headache, are you more likely to medicate, take a Tylenol, meditate, say some quiet words, or evacuate, get out of your house and go to the emergency room? The polls are closing in 5, 4, 3, 2, 1. Awesome. All right, we have more meditators than medicators on the line today. Now, I'll be honest with you, it can go either way for me. It just depends on the day and how bad the pain is. So I've talked to some of you already, and you've mentioned some of the things that are on this list, and you say, but I haven't taken anything because I'm pregnant and I know I can't take anything. False. Look at all these things you can take. So some of these are not necessarily medications. Some of these are relief measures. So again, these are common discomforts in pregnancy. So we used to get lots of messages about all of these things, and the first bit of information or suggestions that we would give you, we just decided to go ahead and put it in a document. So definitely, if you send me messages that say, I'm having some nausea, I'm keeping my food down, but I'm having some nausea, the first thing I'm going to say is, are you doing small meals? Are you avoiding odorous things? And all of the things that are on here. You'll also see, though, if the relief measures aren't working, we can move over to the right side and see the medication column. And it also has some caveats there. So what things to avoid and when to contact us. So if you're having nausea and vomiting, you're not keeping your food down for 24 hours, like no liquids at all either, please let us know because it's time for IV fluids and we need to upgrade our treatment. So all of these things here, just if you've exhausted everything on here, really, just let one of us know because then it may be time for us to evaluate you for what the next step is for things that you can't do at home for yourself. So this is again something that you can print out, something you can download, because I promise every time you need one of these things, it's like 2 o'clock in the morning. You're like, oh my goodness, what can I do? I need something. All right. We are not going to click on the gestational diabetes screening test square, but I'm going to refer back to it a little later on. And we will click on the weight gain in pregnancy because I have so many of you who are so concerned because you don't want to eat anything in your first trimester. You're like, I'm not going to gain enough weight. Don't worry. Yes, you will. Babies are adorable little parasites. They are going to take the best of what you have eaten and leave you with not very much. So, your prenatal vitamins at this point are for you because your baby's going to take what he or she or they need from you. So you can find out how much weight is recommended for you to gain in all of pregnancy based on what your starting body mass index was. So you can use this link here, type in your height and your weight, and it'll give you your pre-pregnancy body mass index. And based on that, it gives you what your recommended weight gain is in pregnancy. If you're having twins, you can add 10 pounds onto the upper number there. So good for you. But do look at that last column because it says the weights of weight gain are in your second and third trimester per week. So no one's faulting you if you're not gaining weight in your first trimester. It's okay. Everybody's nauseous. Everyone has food aversions. Nobody's gaining weight then, or not gaining very much. Now, if you are gaining a lot of weight in your first trimester and you see that you are on a road to getting out beyond of what your recommended weight gain is, just know that excessive weight gain in pregnancy does increase your risk for cesarean deliveries because it increases malposition babies, which I'll talk about in just a moment. And while we're going back to the webinar, I'm going to read, can we take sit down baths? I've read it's not safe because it could raise your body temp too much. You want to keep your bath temperature around 100 or less. But yes, you can sit in the tub. Enjoy. Birth preferences is our next box that we're going to click on. So for those who are planning to make a birth plan at some point, um, birth is unpredictable. For my veteran mamas, it's practice for being a parent. Kids are unpredictable. They never do what you think that they're going to do. So sometimes, though, if you have some anxiety around what's going to happen, it can help to just kind of write down a way that you would like things to go. It's like putting your affirmations out there, telling the universe what you would like to see. So you're welcome to take a look at this form. Sometimes it can look kind of daunting, but each box, there are like 21 boxes on here. Every box won't apply to everybody here. So you can take it one box per week and just kind of read, ask around, ask people, talk to your doula, find out what things are salient to you. Everything from how you'd like your labor to start to what you want to wear when you're in labor, how you want to be monitored. Some of these things will definitely, be person specific. If you have twins, we do need to monitor you in a different way than if you don't. With regard to pain relief, we have, it's a hospital, so we have IV pain meds, we have epidurals, but we also have hydrotherapy. So we have tubs available for labor. It's not something that you have to request ahead of time. If you come in and you're a good candidate for getting in the tub, meaning that you're full term, and not bleeding, like really, and in active labor, then we'll fill up the tub for you. And laboring in that warm water is so nice. The nitrous oxide has been on order for a moment. The machines are in, and now we're just waiting on the tanks. So I believe just about everybody on here, by the time you labor, you'll have an opportunity for nitrous as well. But just take a look through each one of these. I think one of the main points is that we're not starving you and strapping you to the bed. We want you to be hydrated. We want you to have enough glucose and energy so that you can push because this is work. Labor is work. You can push in any direction, in any position. You can deliver in any position. Our usual is perineal massage, delayed cord clamping, immediate skin to skin, early latch or early pumping. If you choose for placental encapsulation, let us know at the time of delivery so that those appropriate arrangements can be made for you to transport it off the premises. The routine medications that are typically offered to the newborn are listed on here as well. Remember, you always have the option to ask the midwives what these medications are for. Sometimes people refuse them and they don't really realize why they're offered to the baby. Sometimes they may not apply to you, but sometimes they do. There's things on here about circumcision, breastfeeding. Our usual is, like I said, early latch. For twins, we have special conversations about twin deliveries. And then for our belly birth moms, we do practice gentle cesareans. So, sometimes we plan vaginal deliveries and we end up going back for a belly birth. Gentle cesareans are patient-centered, family-centered cesareans. And I think we have some advertisement out about that as well somewhere on our socials. So again, how to eat an elephant one small bite at a time. Going back to the website as I answer this, all the alternative birthing methods, i.e., tub birth done at the hospital. All of this is at the hospital. We only deliver at the hospital. We don't deliver in the tubs at this time, but we are laboring it in the tubs. So everything I'm talking about today is at the hospital. This is at HCA Florida. All right, cervical ripening techniques, because at the end of pregnancy, when everyone's asking you if you had the baby yet, you are at home furiously, desperately trying to figure out how to get this baby to decide to come out of you. And these are all things that you can do to make your cervix softer, get your uterus more toned so that when baby does give the signal, your uterus and your body work efficiently to get this baby out. So you can read all of these things, red raspberry leaf tea, evening primrose, using your breast pump, membrane sweeps here in the office, that sort of thing. So just know that this is out here. We have prepared all of this for you so that you do not need to go and seek information about taking castor oil because that is not on the list. If you have an appointment with me, you can always ask me why. First-time moms and trial of labor after C-section moms. I know how many first-time mamas I have. Do I have anyone who's had a C-section before and is hoping for a vaginal delivery? I know half of you this will not apply to. So there are only two options in here. Either it doesn't apply to you or you're trying it and you are going to rock it. All right, polls are closing in 3, 2, 1. Awesome. Okay, we have quite a few child labor VBAC mamas coming out here. Okay, cool. This is for you. First time mamas, you listen up too, okay? Because both of you are in the same struggle trying to avoid unnecessary cesareans, okay? So for those who have had cesareans, you've already known that there's some things you cannot control. Control what you can. These are tried and true ways to reduce your conversion to C-section. Many of you know I am a VBAC mama. Dr. Merrill delivered my VBACs, and she's a VBAC mama. I delivered her VBAC. And Lauren is a VBAC mama too. So we are not just VBAC tolerant, we're VBAC supportive. And all of us did everything on this list. Seeing chiropractor to make sure our hips and our baby are in good position. Because I will tell you, first time mamas, the most common reason I do C-sections is not baby's too big or baby's in distress. It is baby is in wrong position, meaning head is down, but tilted a little bit to the side, slightly crooked, something like that. Sedentary lifestyles lead to malposition babies. Do your squats, get a doula to get you into different positions. Go to spinningbabies.com. You guys can read, but most importantly here, trust your body and your providers. We want what you want. We are not going to be offering you interventions that are going to decrease your chances to have a successful vaginal delivery. So first time mamas, this is for you. Ways to reduce conversion to cesarean. The question that I have out here is, do you still have a birth center? And the answer is no. Full Circle has never had a birth center. So there are many birth centers in town, though. If you just Google birth center and in Jacksonville, Florida, I think you'll probably come up with 3 or 4 different ones that are out there right now. But we are not affiliated with any birth center in town. Circumcision care. If you're having a little guy and you would like to have him circumcised, we do that in the office. They're not done at the hospital because babies need a little bit of time to learn how to be a baby. And you can bring him in before he's 10 days of age. So how this usually works is after you deliver, your midwife will ask you, are you planning circumcision for him? If you say yes, then she notifies Naisha, and Naisha will send you a portal message with this little appointment time. Super easy. Please remember, vitamin K injection is required for circumcision here. Oral is not a substitute for circumcision within the first 10 days of life. All right, fullcirclejacks.com. Remember, that's where all this information is. So you can always come back out here and find it. The next question I have here is about continuing a regular yoga class or whether it has to be prenatal. We prefer it to be prenatal, and I'm actually going to get to exercise in just a moment. But what comes before exercise? Coffee. But is it coffee? Because those who are concerned about gaining too much weight and they're saying, oh, Dr. Adams, all I'm drinking is coffee. Are you? Or are you drinking this thing right here, which is so yummy? Oh my gosh. But look at all the terrible things that are in it. Ooh, don't look at the bottom part. Yes, look at the bottom part. Because did you know that pregnancy only requires an additional 300 calories per day? It's not much. Takes 10 kilocalories to maintain a pound of weight, and your goal weight gain, as we just saw, is based upon your starting body mass index. So if you're starting this pregnancy at 170 pounds, it takes 1,700 calories per day to maintain that. If your goal weight gain for pregnancy is 200, excuse me, is 25 pounds, it takes 250 additional calories for a total of 1950. If you divide that between breakfast, lunch, and dinner, that's 650 calories per meal. But Dr. Adams, all I'm doing is eating 650 calories. Yes, but are you then washing it down with 570 calories of mocha monstrosity? Possibly. So don't drink your calories. Your baby does not know the difference. The baby will take those 300 calories and the rest you get to keep. Happy Mother's Day. Um, Here are some just quick nutrition facts. Remember, all this information is out there for you again on our YouTube channel. This is a very busy slide for you to look at later on. But sodium questions I get later on are, my rings don't fit anymore, Dr. Adams. First question I'm going to ask is, how much salt did you have last night? And there are simple choices that we can make turning our food over to reduce our sodium intake. We want to make sure we're also not overdoing it on our carbohydrates and keeping our protein in an appropriate range so that we're not growing undergrown or overgrown babies. And we'll talk specifically about that in the next couple of slides. Things you want to eat, your fruits, your veggies, your whole grains, your cereal. You're not going to give your baby a nut or dairy sensitivity if you eat those things, so enjoy. For my coffee drinkers, real coffee, you want to keep your caffeine at less than 200 milligrams daily. But remember, caffeine is a stimulant. So at the end of pregnancy, if we start hearing arrhythmias with baby's heartbeat, irregularities in the heartbeat, we may want you to cut back the caffeine even more. Also, remember, caffeine is a diuretic. So you want to use the 3-to-1 rule and have 3 times as much water as you do caffeine intake so that you're not getting dehydrated. Herbal teas are fine. Our favorite ones in pregnancy are raspberry leaf, ginger, lemon, and peppermint. And protein, for my protein eaters, around 70 grams a day is appropriate for pregnancy. I know there are some pregnancy diets that tell you to force 120 grams of protein in, not with the American diet. You will grow an 11-pound baby. Please don't do that. But 70 grams is appropriate. You don't want to be too far under that because then we'll have these growth restricted underweight babies too. Deli meats, yes, you can. As long as you microwave it for 30 seconds, you don't have to eat it piping hot straight out of the microwave, but be sure that you microwaved it long enough to kill any bacteria. Same for your soft cheeses, as long as it's made with pasteurized milk. Those that you're purchasing from the grocery store, just flip them over. It says pasteurized milk, you're fine. If it doesn't, then like you're at a restaurant, then just maybe you don't have the brie that evening. You can have canned tuna up to 3 4-ounce cans per week. If you're pescatarian and you need other kinds of fish and you want to know which ones are okay, the FDA has a really nice document out there about which fish you should be eating in larger amounts because they're high in omega-3s, and that helps with baby's brain development, which ones you want to eat in moderation, and which ones you want to avoid or eat sparingly because of methylmercuries and things like that. It's a long 2-page document, changes with the tides. So just know, again, this is on our YouTube that you'll be able to look that up. Next question is, sorry, actually, I think I'm probably going to answer this in a second. You don't want to eat undercooked meats and fish, and that's any protein. So I think that first question that I had was, can I eat runny eggs? So you want everything cooked all the way through. For my kombucha drinkers, for my kimchi eaters, those are fermented foods and drink. And so you want to cut those out because your body can treat fermented things as alcohol. And by the same token, you want to stay away from alcohol because we don't have a recommended amount that is okay in pregnancy. So we say probably best to, if you're able to, avoid it altogether. And that includes alcohol-free wine because for some reason, I don't know why it still has alcohol in it. And sodium. When you start flipping your food over and taking a look at it, you will be appalled at how much sodium is in our daily diets. To prevent the swelling, you want to keep it under 1,500 milligrams of sodium per day. I think I have some food questions here. Raw milk from a local farm is a no-go during pregnancy, correct? Yeah, that's correct. And then the next question is, what prenatal do you recommend similar to the ones you offer in the office? So the prenatals, I really just go by recommended daily allowance of what's in them. Some of them are very fancy with really beautiful packaging, and at the end of the day, you're just making expensive urine. In all of my pregnancies, your body's only going to absorb what it will. If you have a balanced and healthy and full diet, your body will only absorb from the prenatal what you're not getting from your diet. So as long as your diet is healthy, your prenatal matters a lot less. I took women's one a day because I was always losing my vitamins and I needed to be able to go to the nearest CVS and just pick up some more wherever I was. So if you have specific things like it has to be vegan, it needs to be, non-GMO and, organically sourced and all of those things, there are a list of those that are fine. But as long as you're meeting the same recommended daily allowances that are on ACOG documents, your 18 milligrams of iron, and things like that, then you're going to have enough. Your 400 micrograms of folate. You usually won't get enough calcium from them, but you'll get it dietarily. All right. Any other questions about food and vitamins and all of that? Okay, cool. Exercise and pregnancy. So it is perfectly fine for you to continue your pre-pregnancy activity unless your pre-pregnancy activity was doing nothing. But you just won't feel like it in your first trimester. You're tired. You have this miserable fatigue and haze over yourself all the time. In your second trimester, you increase your blood volume by 50%. That increases your oxygen tension and saturation, and those physiologic changes will accommodate more aerobic activity. So just hold on, you will feel better, and you can go back to doing all the Olympiad feats that you were doing before. But listen to your body until that time. Don't push yourself past being tired. It's not worth it. For those who were not doing anything prior to pregnancy, it is okay to start a new regimen because, as I mentioned before, a sedentary lifestyle leads to malpositioned babies. With more people working from home, sitting at that computer all day long and kind of slumped back in the chair like this, that encourages baby to descend in the pelvis in a sunny side up, like their face is up, their head's down, but their face is up. Position, and that is the hardest way to deliver a baby vaginally. So please get up and please be active. Give yourself timed breaks so that you can get up and move around. Question I have is it safe to exercise if you have a small subchorionic hemorrhage or hematoma? That may actually apply to a lot of people because they're so common. So I'll go ahead and answer that one. If it is less than 1/3 of the size of your baby, then it's okay to go back to exercise because 9 times out of 10, they're going to resolve without any incident anyway. And we really stop following them after that point. For those of you with these cute little Fitbit watches that you're, constantly watching your heart rate, which seems like it would be anxiety inducing to me, but whatever. I'm old. I don't watch my heart rate all the time. You'll notice that your resting heart rate will go up by 10 to 20 beats per minute just at baseline. And that is normal. That is physiologic. That's what it is supposed to do in pregnancy. If you are starting to feel lightheaded and dizzy with your elevated heart rates, though, that is not normal. So please let us know about that. For those of you who are saying, I have been exercising, Dr. Adams, I walk all the time. And I said, we're going to talk about that. So now we're going to talk about it. Walking can be considered exercise if when you walk, your heartbeat is in the aerobic zone. So now Fitbit wearers, pay attention. The aerobic zone is 70% of your maximum heart rate, which is 220 minus your age. So if you're 30 years old, we start with 220, we subtract 30, and we get 190. So that is your max heart rate. You should not be exercising with your heart rate sustained over 190 for extended periods of time. The aerobic zone is 70% of that, though. So your goal is to get at least 70% of that, so 133. So if when you are walking, your heart rate is between 133 and 190 for 30 minutes, 3 times a week, then your walking is exercise. But if it's just, I walk from my car to the copy machine, to my desk, back to the copy machine, you're probably not getting your heart rate up that much. And so that walking is just transportation, not so much exercise. We can find something else to help you exercise, though, like cardio. You like cardio? Me too. Treadmill, absolutely. Elliptical, go for it. Running, yes. Swimming, sweet. Indoor bike, sure thing. If you have a Peloton, my leaderboard name is Off My Meds 8. Feel free to follow me. I will follow you back. We'll keep each other honest. I've been terrible with my exercises, so I need more of you to help cheer me on out here. Other things that you can do, if you were lifting weights, you can continue to lift up to your pre-pregnancy level. No need to increase your resistance during pregnancy because your baby and your body will increase your weight and your weight load. If you are squatting, this is absolutely my favorite thing. Please continue to squat. For those who are experienced squatters, carry on. For those who have not been squatting, at 20 weeks, I want you to start giving me 5 squats per day. 21 weeks, you're giving me 10 a day. 22 weeks, 15 a day. Build up to 50 squats a day. They don't have to all be in the same session. You can give me 25 when you hit the floor in the morning and 25 before you get into bed. That helps to open up that pelvis and help that baby descend in the right position. Also, speaking of opening up the pelvis, yoga and Pilates are two of my favorite pregnancy exercises as well. And they should only be completed with pregnancy modifications. And I think that was a question that we had earlier. Yes, there's your answer. Um, the question I have up here is there an upper limit for your heart rate you recommend to stable? I think you may have put that one in there before I answered that on the previous one. It's 220 minus your age. So exercises you want to stay away from, high intensity intervals after your first trimester. It's not the intervals, it's the high intensity. You can do the low impact versions of these exercises. You just don't want to do anything that creates shearing forces that will tear the placenta away as you're moving around, jerking back and forth. Anything that has you lying flat on your back for extended periods of time, for example, excessive ab work, like you can do standing abs, you can do side lying abs, just not abs lying directly on your back. Hot yoga, unless you're a hot yoga instructor and are fully acclimated to that environment, you will get dizzy and you may pass out, like you may fall and fall on your belly. That would be even worse. Other things to avoid, scuba because of the drop in barometric pressure, decreased oxygen to the baby, high altitude hiking. You can visit high altitude vacation destinations. Your family in Colorado, say hello, but don't go hiking with them. Contact sports, please don't start kickboxing now. This is not the time. And then outdoor biking after 16 weeks has an asterisk just because it's not an absolute no. Just be aware that your center of gravity begins to change around 16 weeks. And times when you used to just be able to turn a sharp corner, sometimes that belly drags you over and you may be hitting the sharp corner instead. All right. Other questions about exercise before we move to the poll question. Trampolines are a no because that's the equivalent. The question is, what about trampolines, like the trampoline park with the kids? Aside from the fact that you may probably wet yourself because there's now a lot of weight on your bladder, no, that's the equivalent of like the high intensity shearing forces that we want to stay away from. You were bold, man. Even wanting to do, I don't do trampoline parks now. I haven't been pregnant in a very long time. Can you prevent gestational diabetes? Now that we have talked about diet and exercise, can you prevent gestational diabetes? Keep yourself from becoming with diet and exercise alone. And you are already answering those polls. You're click, click, clacking away. And the polls are closing in 3, 2, 1, boom. All right. Oh, it was almost even. Okay. So the answer is that you cannot prevent gestational diabetes. That was the key word here with diet and exercise. You can help to manage it, but you can't prevent it. And the question I have out right now is, would you say 30 minutes of exercise and stretching is a good amount per day? Absolutely. If everybody would commit to that, that would make my job so much easier. So yes, please do that amount of exercise and stretching per day. So, what is this mess about you not preventing gestational diabetes, Dr. A? Let me tell you why. This is why I universally screen everybody for gestational diabetes. It is because your number one risk factor is your placenta. You know how we blame a lot of things on our hormones? Yeah, your placenta gives off hormones as well. And it gives off this one particular really sneaky hormone that tells your insulin not to do its job. And your insulin's job is to make sure that you're using your glucose for good and not evil, for energy. And if your insulin's not doing its job, then you just have all this excess glucose out here circulating in your bloodstream. And that's diabetes. That is insulin that doesn't do its job gives you extra glucose because of your placenta, gestational diabetes. So it's a type of diabetes that only happens because you have a placenta. Now, if you can figure out how to do this pregnancy without a placenta, then I won't screen you, but everybody gets screened, or some sort of testing. If you've had bariatric surgery, then that is an exception, and we go straight to glucose monitoring instead of glucose testing. So for my moms who say, but I never have any type of sugar at all, you have fruit, you have whole grains, and you have your healthy carbs. Those are the ones that we want you to incorporate because having no carbohydrates at all is not healthy at all because carbohydrates are for energy. You need energy. So you will have a false positive if you avoid carbohydrates prior to taking this test. If it is the drink itself that gives you trouble with the test, we have lots of different options out there. Remember that box that we didn't click on the website that was about gestational diabetes screening? It has many patient-driven options. So you have options such as the Simply Pure drink, which is available for purchase here at Full Circle. It is soy-free, it is dye-free, it is gluten-free, it is BBO-free, it is kosher, it is vegan, it is offensive to almost no one. There are also the Fresh Test and Glucorganics, as well as glucose tablets, which are patient-driven options. If you are planning to do something other than the lab provided drink, please let us know because we need to put that on your test slip so that the lab knows to expect that. And you cannot go to Quest. Quest does not accept outside drinks. They only allow you to take their drink. So please let your midwife know if she's ordering your glucose test if you don't plan to use the lab drink. All right. Um, Preparing for birth, childbirth education classes for those who are trying for unmedicated deliveries or for those who are just trying to delay epidural until they need it, like an active phase. We recommend method classes. These are just some examples, again, for informational purposes, but the ones that are listed here have Lamaze and hypnobirthing and hypnobabies and Bradley method as well. Supporting her is actually one for dads. So if we have spouses or fathers or significant others who are on the line and want to know, what do I do with this wonderful emotional person that has dropped off at my house? This is how you support her and not get into trouble. Y'all, some of the things I hear these support people say in the delivery room, I'm like, whoa, you definitely should have taken a class before you came in here and said that. So please avoid getting pinched in the labor room. Take some sort of course or something so that you don't say the things that make her angry when she's in labor. We also have breastfeeding classes, as we mentioned, at the hospital and La Leche League. Every new parent should know CPR. Here's a couple of resources here. Of course, there's the Red Cross, and then there's Jack's Mobile CPR, and she will actually come to you and do CPR classes. If you already know it for adults, it is not the same for infants. I highly recommend knowing infant CPR as well. Chiropractic care, if you're already seeing a chiropractor, fantastic. Just make sure he or she or they are Webster certified. And that is a special pregnancy certification that changes how they make their adjustments according to how pregnancy changes how your body shape. All right, we have another poll question. I believe this one is about doulas. How many of you are planning on working with a doula? Some of y'all are on it. Like at your history visit, you were like, yep, I've already hired my doula. I'm ready. And then some, say, oh, I really don't know. Like this seems like a lot of people. I have a doctor, I have a midwife, I'll have a nurse, I need a doula. There's a lot of people. Yes, it's like you're going to the Oscars. You need a whole team working on you. All right, polls are closed, and more people than not are going to be working with doulas. That makes my natural birth supporting heart happy. Hope those were all first time mamas too, and people who are trying for a vaginal birth after cesarean. So, what are doulas for? Doulas provide emotional and physical support. So they are there for you before, during, and after pregnancy. And so they help you with breathing techniques. So they help you to get into positions to help change baby's position so that's easier for your little one to be born. They help you with relaxation strategies during labor. They are not just for people who say they don't want to get an epidural because, again, labor can bring on anxiety, the uncertainty of being in a new space, doing something that brings on a lot of adrenaline. It's very helpful to have a safari guide in there when you're on this journey of bringing little people into the world. And so doulas are not there to give you medical advice or give you medical care, prescribe medications, or to deliver your baby. So don't worry. Full Circle is here to do all of those things. So you don't have to worry about finding a whole separate team for all of that. We are here for that. That's what prenatal care is. And so you've hired us to do that. We're going to do those things for you. But we work very closely with doulas because they are amazing parts of the birth team, and they stand in the gap when we have more than one patient admitted in labor. Your doula is with you. Your best doula is the one who's going to come to your house when your labor starts. She comes with you to the hospital and stays with you until that baby is latched. I mean, these doulas are superheroes. Sometimes they're at the hospital 48 hours straight, just waiting for you with that baby. And if you want a doula and you don't know how to find one, ask the midwives. Man, they have no shortage of opinions on who the best doulas are in town in terms of who we've seen supporting our patients. Other things you can do in preparing for birth, for pain relief, acupuncture. When you come out of the bathrooms in the front, there's a row of business cards there. And everyone who is there, we've seen support people in labor and during pregnancy. That goes for pregnancy massage as well. Some places require a letter. We do have a standard massage letter. So if you need it, you can send a message and we'll give that to our OB coordinator. And she will send you a letter saying that it's okay for you to have a pregnancy massage. Question here is husband doesn't understand why we need a doula with midwife slash doctor and if he's there as well. I'll tell you, my husband didn't understand that either until our second baby. And what he said was, you know what? Actually, I don't want to be the one doing the hip squeezes, timing the contractions, helping you squat and do all of those things. I want it like hand me the baby. I will change all the diapers, do all the burping and the feeding and all of that stuff. But you in labor are scary, and so I would just really like someone else to be in charge of scary you. um it's sometimes like your husband has the instinct to want to put the fire out, and they don't always understand why you want to do things a certain way, and so they may impose what they want for your labor. Now you have to know who your partner is. If he is that person that you're Bonnie and Clyde about this, then perhaps Bradley method is for you, and that's a class that teaches your partner to be your doula. So if he wants to stand there in that gap and be that person, then you may want to look into Bradley method to have him appropriately trained for what the interventions are for when it's go time, show time. All right, question I have out here is at how many weeks is it safe to have a prenatal massage? So it's safe at any time, but I'll be honest, most places won't do it in your first trimester just because first trimester has the higher risk of miscarriage and they don't want to be associated with that. All right. Many of your insurances will cover breast pumps. We have a company that we've identified that makes it very easy for you and very easy for us. Please do not go look for your own place to find breast pumps. When you come to your visit, around 20 weeks is a good time, but you can do it at any time. We have QR codes in all of the exam rooms. You scan the code, you immediately get the form, you fill that out. They check your insurance. They see which pumps are offered and covered. They send us a script already filled out for it. All I have to do is put my signature on it and sign it back. These other places will say your doctor needs to write an essay, about why she thinks breastfeeding is important. And so, please don't make me go through all those things, okay? Just please scan our code so that we can get the breast pump from this company that makes it very easy for you and for me. Please and thank you. So just remember that we have that resource available in all of our rooms. All right. Postpartum care. It's going to end. Blood pressure checks for our mamas who have any issues with their blood pressure during delivery. We'll see you back in the office in about a week after you're discharged from the hospital. For my belly birth mamas, we see you about 1 to 2 weeks afterward. Routine mental health screen because postpartum anxiety, postpartum depression, those are things. And to those ends, postpartum doulas are those are things like when else do you need more emotional and physical support? If that's what a doula is for, then the postpartum was made for doulas as well. The motherhood space is an exciting new resource in Jacksonville. that is sadly underused, and we are trying our hardest to fill it so that we don't lose it because we were one of 5 cities in the nation who received the grant through Dr. Jill Garrett to create this postpartum utopia with free childcare, therapy, yoga, all of these things for mamas who need it in the immediate postpartum period. And then pelvic floor therapy, which is standard of care in Europe. We're trying, in America, we're trying. We have a nurse that comes here at Full Circle 3 days a week to provide pelvic floor therapy. So about 8 weeks after delivery is when we would start seeing you weekly to help with things like urinary incontinence, sensation of pelvic heaviness, um, helping your lacerations heal. So pelvic floor therapy is a routine thing after we've seen you for your 6 week visit. Then you start seeing our physical therapist who comes in here once a week to take care of you, try to get things back to where they were because contents shift during travel, just like in an airplane. All right, random frequently asked questions. Yes, you can sleep on your back. You can sleep on your left or your right side. If one side is better for you, grab a wedge pillow from Amazon and stick it under your hip so you don't roll onto your back or whatever place makes you uncomfortable. You can help paint the nursery. Just be sure you're in a well ventilated area and wearing a mask. You can take probiotics in pregnancy as well. You can also get your nails done. You can do gel nails. If you're going to be in the salon with the fumes, though, you may also want to wear a mask just so you're not breathing that in heavily for extended periods of time. You can dye your hair, which includes dyeing your eyebrows. For those of you who have trips coming up, I know spring break and maybe summer vacations and things, car travel is fine for distances more than 50 miles up to 37 weeks. Just be sure that you're getting out and stretching every 2 hours. If you're drinking enough water, if you're close to 37 weeks, you will have to go to the bathroom like every hour anyway. So we're not worried about that. Skincare, you can use your benzoyl peroxide, your salicylic acids, all those things, just nothing that has retinol in it. There is a retinol alternative that is more natural called bakuchiol, Bakuchiol, and that's found in more of your natural products that has the retinol effects without the retinol risk. Flight, you may fly for my twin mamas up to 32 weeks, for my singleton mamas up to 36 weeks. Just please, please, please be sure that you are wearing your compression hose and you are staying hydrated and you're doing your toe raises to exercise those calves and prevent blood clots in your legs that can travel to your lungs. Be sure that you are doing that. Things that you want to avoid because y'all are my summer crew, no roller coasters and no water slides. I guess I have to put trampoline parks on here as well too. Next question I have on here is at what point should we stop sleeping on our tummy? And that is really just when it becomes uncomfortable for you. Believe me, your baby will tell you. You will start getting kicks when you start sleeping on that tummy and the baby does not like it. Cruises allow you to cruise up to 24 weeks. So they will ask for a letter from us about your due date. And if they extrapolate that you're going to turn 24 weeks on that cruise, you will not be permitted to board anyway. But it is fine for you to go until they say you can't. All right, quick COVID-19 update, and then we're done. Thank y'all for hanging in there. With regard to vaccinations for COVID, ACOG moved away from strongly supporting either way to strongly recommending it based on studying 35,000 women in the New England Journal of Medicine April 2021 article. Moderna and Pfizer are okay in pregnancy. Johnson & Johnson is not recommended because it has an independent risk of blood clots, and so does pregnancy. So you don't want to add those two things together. Boosters are also fine. If you've had your Moderna and Pfizer and it's been more than 6 months and you wanted to get a booster closer to delivery for passive immunity for baby, that's fine too. If you're more than 2 months past your Johnson and Johnson, you can get a booster, but not Johnson and Johnson. And mixing and matching is okay. So if your last one was Johnson and Johnson, you want to get a Moderna and Pfizer, that's fine. If you're timing it against your RSV, your Tdap, or your flu vaccinations, they work differently. So it does not matter. You don't have to space them out. You can if that makes you more comfortable, or if you've got someplace to go and you don't need to be going to the pharmacy every week to get it done. We don't do them here in the office. You'd go to either a Minute Clinic or your primary. If you do happen to contract COVID, because this is still happening, there are no recommendations for ivermectin, azithromycin, or Plaquenil, so we do not prescribe those, but the things that we do recommend are the following vitamins. You'll see here that zinc and vitamin D and vitamin C are listed and the recommended doses. We also recommend that you start a low dose aspirin, 81 milligrams daily until you're 36 weeks. So if you get COVID after 36 weeks, do not start the aspirin because you'll increase your risk for bleeding around delivery. If you start it prior to, that will help to reduce the risk of conversion to gestational hypertension, which has been associated with COVID-19 in pregnancy. To that end, we want to make sure baby is growing appropriately, and so we start serial growth ultrasounds after your anatomy ultrasound if you've been diagnosed with COVID earlier in pregnancy. If you do contract COVID, we recommend supportive therapy at home. Remember, our website has things for sore throat and congestion and cough and all of that. You only need to go to the hospital if you're having difficulty breathing or you're unable to keep your fever below 101. I'm answering some questions now. My dermatologist made me stop salicylic acid. Nope, it's actually fine. Is there a percent that we should stay under? No, because it's topical and it barely gets into your bloodstream, and even then, very likely will not cross the placenta. Question is going on a cruise next month, still in first trimester. How do I request the letter just in case? You would, at your next visit, just ask, and they'll send a message to the OB coordinator who will email it to you. The next question is, are COVID vaccines recommended? Yes, ACOG says strongly recommended because it does reduce the severity of you as an immunocompromised person. Pregnancy is an immunocompromising condition. And the last question is, do we get a copy of this presentation? It's on my YouTube channel. And yes, you're going to get a link from Zoom in a couple of days saying that you can go back and watch it again. 4 visitors for labor, plus your DONA certified doula. And so usually 4 is plenty. 4 is more than people usually even want in the room for labor. So that's our standard. Like there's no COVID restrictions on visitation at the hospital now. It's just what we always have been. We're not requiring masks in the room or in the hospital unless you actually actively have COVID when you are laboring, so that you're not infecting your nurse and the rest of the hospital staff. If you do have COVID when you're laboring and or delivering, we're not separating you from your baby. You're given N95 masks and an isolette so baby's not exposed to the respiratory droplets in the room. And I have another question out here. Is there a limit of people in recovery room? No, there isn't. But again, normally you're just trying to rest. And you probably mean I'm guessing you mean the postpartum room, but no, there isn't a limit. But again, you just want to rest and not have a million people there. So what things can you find on the website? Birth plans, safe medication, what to expect at each visit, or all of the above. And FYI, that's the right answer. So you can find all of those things on our website. Awesome. All right. Thank you guys so much for your time. Remember, we are social, so please follow us on all the things. We are on Facebook. We are on X, formerly known as Twitter. We are on Instagram. And this presentation in particular is on YouTube. We have a couple of series out there, which are probably some of the reasons that you guys joined us in the first place. In Her Words and Her Story and Birth Becomes Her. So if you're looking for positive birth stories, please be sure to go to all of our socials and see what wonderful things people are saying about their births with Full Circle. Fill your brain and your mind and your space with positive energy because there's enough drama and trauma around childbirth. We love what we do and we want to show you why we think birth is awesome. It's because we think each and every one of you is awesome too. All right. Appreciate you for your time. Thank you guys so much. And we will see you back in the office real soon. Bye. Love y'all.